Hi, so I read Dying While Black, an in-depth look at a crisis in the American healthcare system by Vernelia Randall.
Hello, and I read Just Medicine, A Cure for Racial Inequality in American Healthcare by Dana Bowen Matthew. And to start, we're going to talk about the overarching theme for us, which was physician bias. So, implicit bias within physicians and other healthcare professionals is a health risk for racial and ethnic minority groups in the US, which leads to a lot of disparity. This book showed a research study that used an implicit association test to see how many people admit to having bias within the healthcare system. And most people said that they do not have any, but clearly, based on how we see people get treated there's a lot of bias within the healthcare system. In this book, many people were interviewed, and very few admitted to holding biased attitudes and were even shocked and offended to hear that question because they want to help people. However, the truth is that many have unintentional attitudes and perceptions toward minority patients that they don't admit to having. This bias leads to discrimination because it has an impact on the way they think about and act towards different groups of people.
So, physician bias is a byproduct of the institution of slavery in America, which encouraged physicians to use Black people for experimentation and medical advancements while refusing to provide them care. That institutionalized system of racism has shaped healthcare today and impacted the rate at which physicians are likely to diagnose and treat Black people. Through research, it becomes clear Black people in America are given less medical attention when seeking help and given less diagnoses and treatment than their white counterparts. The result is that the health of Black Americans is constantly at risk, and this also greatly decreases the willingness of someone to seek treatment after experiencing bias from a physician. So, this demonstrates the physician bias being a byproduct of institutionalized racism.
So, for our second overarching theme, we said it was sociocultural understanding. So, um, my book, Just Medicine, A Cure for Racial Inequality, told many firsthand stories of people who were mistreated based on sociocultural differences and the lack of understanding within healthcare. So, for example, there was a Chinese man who had a liver disease from a bug that bit him, and he knew exactly what that disease was because he had it years back in China. But when he went to the physicians in America, they seemed to just not care, and they said that they can't give him any kind of treatment. But he felt that because he didn't speak English well, the doctors didn't take him as seriously and felt like that they could just brush him off. After that, he had no desire to go to the hospital and lived with the disease because of the doctors who just couldn't communicate well with him. And there was also an Indian woman who had went to an American doctor who wanted to try to get her on a specific diet, but that diet wouldn't work for her because it just wasn't what her and her family eat. They eat very different foods in her culture compared to what an American diet would look like. So the doctor's lack of sociocultural understanding of a different culture was a big disparity to the patient's treatment. And that's why it's so important to have the understanding of different cultures and asking questions, such as in her case, maybe, is it a South Indian or a North Indian diet, and being educated on different things, such as the fact that to make paneer, which is a cultural food for them, they have to heat their milk. But when you heat milk, that contents of fat in it increase a lot. So a doctor who knows nothing about this culture could really affect their treatment. And if a doctor knew more, they would be able to make diet recommendations based on the sociocultural understanding.
So, in Dying While Black, it explores how the institution of slavery brought African people from many different countries together to a foreign country. So, all those people were stripped of their cultural identity. They didn't have a common language, and they were without access to the foods that had shaped their diet up to that point. So, many people were brought from Africa who had immunity to a variety of African specific diseases, but they did not have immunity to those diseases native to America. And they were forced to navigate a multitude of illnesses in an effort to survive. To strip millions of people from their cultural identity while subjecting them to the horrors of slavery is an indescribable evil. The ripple effects of that element of institutionalized slavery is still present today under the guise of the melting pot of America. So by whitewashing cultures under a white supremacist system, healthcare disregards the value and impact someone's culture has on their health and well-being. And finally, the last theme we addressed was institutional racism in healthcare. So America was built around the institution of slavery, and as healthcare and medicine developed in this country, it was shaped by that institution. It becomes clear when looking at the data that throughout American history until today, Black people have been neglected, ignored, and mistreated at the hands of the healthcare system. This has bred a healthy distrust of the American healthcare system, which has directly harmed countless Black bodies through neglect and direct action. In 1999, the United Nations released a report detailing the human rights violations against Black Americans taking place within American healthcare. While this report was acknowledged, no efforts were made to effect any change in the system. The total inaction of the government to change these human rights violations demonstrates how thoroughly racism has been built into the functional systems of this country, and it also demonstrates how the entire system of healthcare needs to be dismantled and rebuilt to undo the systemic issue.
So for long periods of time, there has been institutional racism in healthcare, from when different cultures were segregated to their own spaces in hospitals, such as a completely different floor or even a completely different facility. Black people are being directly affected by institutionalized racism by not receiving equal treatment, such as Black and white cancer patients not receiving the same patient, or Black people not getting the proper diagnosis, the same treatment.
So in an effort to improve healthcare, there's a few ways that we've come up with to affect some change. First, we said that there should be more laws that enforce equity in healthcare. One way that could be enacted is through universal healthcare, so that people receive quality medical care regardless of their socioeconomic status. Another way to do that would be to increase diversity among healthcare providers. So by supporting and encouraging people of a large variety of racial, cultural, and ethnic backgrounds to enter the field of medicine, it's important that's important to the expanding of equity in the care that people can receive. So this also includes making medical school economically accessible and even completely free. And finally, or not finally, but another way would be through the examination of bias training for physicians. So by providing regular comprehensive courses that explain and clearly demonstrate bias in healthcare, it can help show that there's implicit bias built into every person who lives under institutionalized racism. This can help better educate physicians who might otherwise have thought that they were not operating under any bias, as well as to weed out the physicians who are unwilling to surrender their bias.
We can also address nutrition disparities in communities, such as with food deserts. So possibly we can provide farmers markets or grocery stores to food deserts and give them a place to get fruits and vegetables and other foods, since many of these communities may only have corner stores without any nutritious food. We can also have cultural education within curriculums, so make it part of the curriculum in higher education for healthcare professionals to learn about different cultures and the different things you may see across them. Understanding cultures can bring a better understanding to personalized treatment. And understand institutional racism as it shapes healthcare. So educate professionals on the history of institutional racism to understand what lies behind it and how it shaped healthcare today. So how these books will shape us to be better OTs. These books definitely made me want to educate myself more on different cultures and differences so that I can truly give all my future patients equal treatment. And in healthcare settings, as an OT, I can advocate for my patients. So for example, if I see someone who doesn't speak English, I can demand for a translator, because I learned from these books how having a family member translator is not enough, as there are many barriers, such as the fact that if an older person has their grandchild as a translator, they may not want to be transparent about the pain they're feeling, and therefore they will not get the care that they need or deserve. So it's really on the hospital or facility to have a translator available. So if I'm working there as an OT, I can advocate for this. And I could also, as an OT, understand how the history of institutional racism may make patients have their own biases, and I can be understanding of this when working with certain client populations.
So this book helped me see that as an OT, I need to recognize the importance of understanding the impact institutional racism has had on each individual, and the variety of ways that could be affecting their health and well-being. It also showed me that it's important to recognize where the healthcare system has deliberately and systematically neglected and harmed Black Americans and given them a distrust of healthcare providers. And it also helped me want to strive to provide equitable care to all of my patients, ensuring that I'm part of their journey to wellness and occupational life balance while working under the system that was created within and around institutional racism.
Thank you.